I mean, I'd say for me, the easiest problem that patients are really bothered by, but is actually easy from a functional medicine standpoint to help them with, is when patients have irritable bowel syndrome. It's an incredible interruption to life. It's embarrassing, they hurt a lot, and when your stomach hurts, it's hard to attend to other things. I mean, that deep pain that you get with that is really distracting. And so I see people that are extremely debilitated by that illness, and they come into me and they say, I've been told I have IBS and maybe try some probiotics. So they've tried a few things, but in a very unthoughtful pattern. Just, I've heard, I went to the health food store and they said this works, kind of thing. And I'm able to, with testing that I have access to really get to an understanding of what might be the primary dysfunction in irritable bowel syndrome, which is a functional disorder of the bowel. When you go to a standard gastroenterologist, that's what you're told. You have a functional bowel problem. And that's the end of the diagnosis. And wow, I can leave and still have my pain all the time and embarrassing problems. And then you come into my office and I say, well, which function isn't working? You know, is it your digestive function? Is it your absorptive function? Are you inflamed because you're eating a food you're allergic to? And I have a battery of tests that I know how to interpret and have access to that can really help me ferret that out pretty quickly and effectively. So I'd say there are many patients that I've walked through that walk with that have gotten back to a regular, happy, functional life, and mood disorders sometimes clear with that. I mean, it's really amazing all the other aspects of their life that get better when you clear up their stomach. Joint pains will often get better, stamina for exercise improves, thought processes clear up. So that's a very delightful patient to have come in.